Hello, I'm Dr. Bang the hair magician here to protect your hair. It is a genuine pleasure to meet all of you. Today, I'm going to present something many of you have been curious about. I've been showing photos of our actual surgery patients one by one, and in these cases, you can see there are significant individual differences. Some individuals appear one way, while others appear differently. Therefore, I intend to demonstrate the true appearance of individuals, regardless of gender or age, on the very next day after their surgery, whether it be day 1 or day 2. So for days 1 and 2, the primary concerns are often about the extent of facial swelling, how much redness will be visible, or the amount of bleeding. There's also curiosity about the actual appearance of both the transplant and harvest sites. Hospitals typically assure patients that everything will be fine and well concealed, but I aim to show you the genuine visual reality. Therefore, I've prepared photos of about 10 individuals, including both men and women, which I intend to show you all. When you see it for yourself after about a day, you can gauge the level of swelling and think, if it's this swollen, I can simply cover it with my hair. Regarding the harvest area at the back, I find it can sometimes be noticeable, depending on the surgical method and the amount of hair extracted. However, typically, it's almost imperceptible, allowing you to maintain discretion. If I simply kept telling you this, you might just dismiss it thinking, oh, anyone can say that. So instead, I intend to visually demonstrate it for you. As you will see when you look through the photos, the redness can appear more prominent than you might expect. It might look even more pronounced in the pictures, especially since this involves a wound on the body. Not only will there be bleeding, but also bruising. For the first 1 or 2 days, if the transplant area isn't covered by hair, it can definitely be noticeable. However, if it's well covered by your hair, the shadows created help to conceal it. So, though there may be some swelling on the first or second day, the bruising won't appear overly awkward. The biggest issue, I always say, is swelling. Now, what exactly is swelling? When surgery is performed in this area, that swelling tends to trickle down towards the forehead. And if you're someone whose face swells easily, you'll swell even more. So, it flows down, settles around this area, and is absorbed, which is fine. However, if cold compresses aren't applied effectively, this swelling can create excessive pressure around the surrounding capillaries, causing them to burst, even in areas not directly operated on. Then this area suddenly starts to bruise, and when you're swollen and bruised, things start to look serious. Thus, for the first 3 to 4 days, it's beneficial to frequently apply a cold compress to your forehead, not the transplant site itself, to help absorb any swelling. It not only looks better to others, but also makes your daily life much more comfortable. Now, it varies by clinic, but speaking for our clinic, you can touch the transplant area and everything else starting the day after surgery. You can touch it without concern. We've implanted the hair safely enough for you to do so. I don't mean you should touch it constantly, but you absolutely should touch it while shampooing and gently rub to rinse it out, right? It gets cleaner and much tidier, which is better for you. That's what I'd tell patients. For about 1 to 2 days post-surgery, the wound in the harvest area at the back of your head isn't fully recovered. This means you might experience some stinging or itching sensations there. We call this an unusual sensation. The anesthesia hasn't completely worn off, so there might be some numbness, and areas you put pressure on while sleeping might feel a bit more tender. But if you look through the photos, you'll see parts of the wound already starting to recover after just 1 day. So, to recap, in the first 1 to 2 days, you can expect swelling and bruising, and while there are individual differences, the swelling can be managed. I can tell you that if your hair covers both the front and back areas, you can generally go about your daily life without significant worry. Today, I wanted to show you what you look like 1 or 2 days after surgery. Pain is subjective, making it difficult to fully describe, but generally speaking, patients report that the pain is not overly intense. So please don't worry too much, as it won't be overly noticeable. I believe that's what I wanted to convey to you today. Thank you.